Hi, everyone. I'm Nahid Nenshi, Mayor of Calgary. And with me today are two of my favorite Calgarians, the co-chairs of our Community Action Plan on Mental Health and Addiction, Karen Gosby and Dr. Chris Eagle. These folks have been leading our critical work on mental health and addiction that we've been talking about for some time, and of course has fallen into even greater focus as a result of the COVID-19 crisis. So Dr. Eagle, let me turn it over to you just to say a little bit about community action on mental health and addiction.
Thank you, Mayor. I'm proud to be co-chair of the Community Action on Mental Health and Addiction, along with my co-chair, Karen Gosby. This is a group of 20 remarkable volunteers convened by the City of Calgary. There's never been a better time to do this work. As the Mayor mentioned, we have a crisis in mental health and addiction, and that crisis is made worse by COVID-19 and the economic impact of the oil price shock. However, in a bold move, the City of Calgary last year announced a plan to invest $25 million in mental health and addiction. I have a professional interest in mental health and addiction as a physician, but also as the former CEO of the Alberta Health Services and Calgary Health Trust. I have seen the impact that mental health and addiction issues have across Alberta. There's a lot of great support and care being provided, but the system is hard for patients and families to access and navigate. And most importantly, I have a personal interest in mental health and addiction since my younger sister died by suicide 1 year ago. I know firsthand the impact mental health issues have on individuals and families. I know our group of volunteers supported by the City of Calgary will continue to do great work. Next, we'd like to tell you about one of our early successes, the Change Can't Wait initiative. I'll turn it over to Karen Gosby to say more about that. Thank you, Karen.
Well, thank you, Dr. Eagle. And we all know how important strategy and plan. They're very important elements in order to get help. And the City of Calgary has convened a group of people that know that people are suffering right now and they need to get help right now. So we decided to move forward with the Change Can't Wait. And we pitched it to Calgary, the people of Calgary, to organizations to try to fill the gaps, to access the help that people need and to be able to navigate it when people need the help. And through Change Can't Wait, in total, we managed to come up with the City of Calgary and funding partner $700,000 to move ideas to action, and came up with some 15 great ideas that we're really excited to get going and start this process.
Hi, my name is Melanie Hulsker, and I'm the Director of Calgary Neighborhoods at the City of Calgary. The Community Investment Table is a group of funders who are committed to taking immediate action to address issues of mental health, addiction, and community safety. In addition to the $1 million earmarked by the city, we've been able to leverage $275,000 to invest in fast pilots that will put immediate action around the issues of mental health, addictions, and public safety. Today, I'm pleased to have the other members of the Community Investment Table here to help announce the projects that will be funded through this investment.
My name is Jason Bates, Vice President of Grants and Community Initiatives at the Calgary Foundation.
My name is Mike Meldrum, President and CEO of the Calgary Health Trust.
My name is Mona Hunter, representing the Hunter Family Foundation.
I'm Susan Brooke, VP of Community Impact and Partnerships, representing United Way of Calgary and area.
My name is Karen McDonald, Chief Operating Officer of Viewpoint Foundation.
And I'm Kat Van Willingen, also representing Viewpoint Foundation.
On behalf of the Community Action on Mental Health and Addiction Stewardship Group and the Community Investment Table, here are the 15 projects which have been successful.
24/7, clinically monitored, online peer support, delivering digital, peer-to-peer mental health services, including courses and resources.
Recovery coaches, peer support for individuals with substance use disorder to navigate community resources and receive tailored care.
Accredited Wilderness Addiction Treatment Program, delivering a 30-day land-based teaching treatment program for Indigenous youth.
Language Link to mainstream mental health, providing language support for newcomers to access mainstream mental health services.
Online connection tool and booking solution, connecting Calgarians to counseling services and appointment bookings with multiple organizations in one online tool.
Applied Suicide Intervention Skills Training, integrating suicide prevention training into the Faculty of Nursing curriculum.
Confidential Wellness Wayfinder, connecting Calgarians with relevant mental health services and peer support through a website and app.
Mobile Street Health Team, connecting vulnerable Calgarians accessing emergency medical services with social supports and community connections through Health Navigators.
Senior Mental Health and Addiction Outreach Team, providing short-term in-home care to seniors to increase protective factors, identify risk, navigate resources, reduce isolation, and create safety action plans.
Anxiety workshops for all Calgarians, training to deliver cognitive behavioral therapy programs for anxiety.
South Asian Youth Mental Health Outreach Ambassador, training South Asian youth to become mental health ambassadors for the South Asian community.
Older adult men's wellness workshops and peer support, delivering wellness workshops for older adult men to build knowledge, develop skills, and connect to ongoing peer support meetings.
Shelter Diversion, supporting individuals entering the shelter system for the first time to navigate mental health and addiction needs and connect them with appropriate resources.
Automated self-serve health website, connecting Calgarians to available mental health and addiction services, including community care options.
Service navigation for vulnerable Calgarians to navigate community resources and receive tailored care.
I am very excited about what we're doing here with Change Can't Wait. We've talked a lot about the need to not move at the speed of government. We've talked a lot about what I call fast to pilot, fast to start, fast to fail. And that means that some of these may not work. Some of them may, in fact, fail. But we can't wait. And it's important for us to test these things out and see how well they work. And if we take this approach that we're willing to do anything in order to make a difference in the lives of people struggling with mental illness and addiction, that means that we're doing good for people. And we know that during this COVID-19 pandemic, the issue is going to be tougher than probably ever before. And so it's critical that even now we're moving in an incredibly reactive way to try and get ahead of this, just as we are with COVID-19. So Change Can't Wait is just one of our approaches to fast pilots. We had so many applicants this time. They had great ideas. We weren't able to fund everybody, but we'll be engaging with folks again as we identify other areas we can access. We're focused right now a little bit on access, navigating the system, but there's lots of other avenues to explore. So I want to say to everyone who submitted their ideas, thank you. Thank you for submitting those terrific ideas. We funded the ones we could, and we are going to move forward with so many. Thank you for caring so deeply. As I always say, 1 in 4 of us is going to be touched by mental illness at some point in our lives. It is critical that we here in Calgary come up with a Calgary-born and based solution that other people in the world can use in terms of truly making change in people's lives. And for those of you who were selected for phase 1, good luck. I can't wait to see what comes back. But mostly, I want to say thank you to everyone who's worked so hard to make this happen. And in particular, thank you, Karen. Thank you, Chris, for your tremendous leadership in this. We're moving forward because we know that change can't wait.